First at 4, winter weather advisories now in effect for all of southeast Michigan as snow is on the way, and it's not our only shot as we head into the weekend. Karen?
Also, now they will get to play. Winter high school sports are coming back. We'll tell you how soon. And what about safety restrictions? Also, Dr. McGeorge is kicking off a big event.
Karen, we've been swamped with questions about when, how, and where people can get COVID vaccines. I'm working with a team of reporters to get the answers you need about availability and distribution. It's information you'll want to share with family and friends, starting first at 4.
Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News First at 4 starts now.
Good afternoon, everybody. I'm Karen Drew. First at 4, a winter weather advisory is going into effect right now, and we will see the impact going into tomorrow morning. On your TV screen, we are going to take a live look outside, and you can see gray skies over downtown Detroit, and we'll be watching that radar very closely for a few inches of snow. Meteorologist Ben Bailey, he is a busy guy over in the weather office. How's this going to play out?
Well, Karen, I think some of us are going to see this before the commute is done tonight, but you're right. The biggest impacts will be on that drive tomorrow morning. Here's Storm Tracker 4. Watch down here in the south zone. We're starting to see returns just in that southwest corner of Lenawee County, but you look a little bit further to the south, and that is a real deal stripe of snow there coming out of Fort Wayne. So as that band sort of lifts to the north, we are expecting to see those snow showers again before the end of the commute in parts of the area. Winter weather advisories are in effect, as we mentioned. Timing-wise, this will stretch at least through the overnight hours, maybe a little bit of a mix around the midnight time frame, but that's not for everybody. Could be confined to just the south zone and maybe some downriver areas. It's all wrapped up by about 3, 4 o'clock in the morning, giving crews some time to clear at least the main roads before tomorrow morning. Winter weather advisories extend till 4, and beyond that, we've got more snow on the way, we've got more cold, and we've got plenty of wind to sandwich in the middle. More on that in just a few minutes. Karen?
All right, thank you, Ben. Breaking news from Lansing, where the pause in play is being lifted. Governor Gretchen Whitmer just announced a couple hours ago that winter high school sports can restart, and that starts next Monday. Now, that 2.5-month pause has been fought by some parents and students and Republicans in the legislature. Kimberly Gill in the newsroom, and there are some new rules for the student athletes, Kim.
They are, Karen, and good afternoon to you. Sports such as basketball, ice hockey, and soccer can begin on Monday. The governor says her administration made the decision because of a drop in COVID cases, and student athletes still need to do their part, though, to keep the numbers down. That means masking up. In the new order, athletes must wear masks while they play. For sports where they can't wear masks, students will still need to be tested. More to come on how often a little bit later. Outdoor non-contact sports can continue without masks. The state is expected to release more guidance on Sunday, and that will include a recommendation that game attendance be limited to 2 people per athlete. The governor says outside pressure, like the big rally at the state capitol over the weekend, did not play a role in this decision.
That's not what drives decisions in my administration. It is the science, and I'm proud to say that the pause has worked. We are a leader regionally, we're a leader nationally, and we're in a strong enough position that we can do this safely, and we'll continue to follow protocols and continue to watch our numbers. But we want our student athletes to be successful, and I'm really pleased that we're at this moment now and that the numbers tell us that this is a safe step to take.
The group Let Them Play filed a lawsuit earlier this week to push the governor to do this. They say they're reviewing the details of the order issued today and will then decide whether to drop the suit. Karen, much more on what's next for student athletes coming up on the news at 5.
All right, thank you, Kim.
Sure.
And we also want to get you caught up on today's numbers. The state is reporting more than 1,300 new cases of the virus in the past 24 hours. We've also seen an additional 74 deaths. This number is also becoming more and more important. Governor Whitmer just said the state has administered more than 1 million vaccine doses as of yesterday, but that broad number doesn't tell the whole story of what's happening in our Metro Detroit communities. And that's why our entire Local 4 team is working to actually track those vaccines. Who is getting them and who can't find them? Many county officials say the supply they're receiving is far less than they would like. So we are kicking off a very special event right now with Dr. Frank McGeorge. He is here with a dive into how the state determines how much vaccine goes where. And so many people are wondering this, Doc.
Well, and for good reason, Karen. But here's the thing, one that's really important to remember and acknowledge up front. Simple fact is, on a national and state level, there is just not enough vaccine available for everyone who wants it. And that means decisions have to be made about where that limited supply goes. And unfortunately, that process, well, it's just not going to make everyone happy. The first guiding principle of the state's vaccine strategy is that all Michiganders have equitable access to vaccines. Yet, when you look at the state's COVID-19 vaccine dashboard, there are some immediately apparent distribution differences. You can see on the first page where the vaccines have shipped by county. Oakland County is shaded in teal, showing a high level of vaccine distribution. Detroit is light green, having received a moderate high number of shots. Washtenaw County is yellow at a moderate level, while Macomb and Wayne County are orange with a lower level of distribution. The majority of the state is shaded red, suggesting a low level of vaccine distribution. According to the spokesperson for the MDHHS, a big reason for this variation is that at the start of the vaccination campaign, healthcare systems received the majority of vaccine targeted for Phase 1A healthcare workers. So, counties with more healthcare workers received more vaccine. You can partly see that reflected on this map on the third page, showing where people who received the vaccine live. Oakland County again stands out in teal, a high number of people receiving the vaccine. But Wayne County is now green at a moderate high number of people receiving a shot, and now Detroit is a shade of red, like most of the state, showing a low number of residents receiving a shot. That's because many 1A frontline healthcare workers work in the city but live in other counties. According to state officials, when Michigan opened up distribution on January 11th to people 65 and older, frontline essential workers, and teachers, that necessitated a change in the allocation formula. One of the principles for this new allocation is that health disparities should be reduced and barriers to vaccination should be minimized. To accomplish that, Michigan, like many states, are adjusting allocations based on something called the Social Vulnerability Index. This number is calculated using census data for 15 different social factors, like poverty, education level, disability, access to transportation, extremes of age, and language spoken. Most areas in Detroit have a high social vulnerability index, compared to most areas in Oakland County that have some of the lowest social vulnerability. People living in areas with high social vulnerability are at risk for more severe COVID outcomes, so prioritizing them makes sense. The MDHHS shared their formula for vaccine distribution that includes the Social Vulnerability Index. Basically, the population of a county is multiplied by a Social Vulnerability Index multiplier, giving a population that's adjusted up or down based on the vulnerability of that area. That adjusted population then becomes the basis for allocation decisions by the state. Because the numbers of vaccine distributed to date are a combination of the earlier distribution to healthcare workers and the newly adjusted distributions, when you calculate the number of doses shipped per 100,000 people living in a county, the results are not well balanced. Washtenaw County has received almost 3 times the amount of vaccine than Macomb County adjusted by population, and Oakland County has received nearly double Macomb County's distribution per person. And comparing the number of doses per 100,000 people between Detroit and the remainder of Wayne County, the city of Detroit has received between 2 and 3 times the number of doses than the entire rest of Wayne County. When you do the math and you see numbers like this, it becomes obvious why people living in certain areas are especially frustrated with the distributions to date.
There is a lot to factor in here. Now, what about the number of doses people actually have received by county? Is that even, or is that all over the place too?
Well, you know, Karen, it kind of is all over the place again because there's been a change or update to the distribution. On a population basis, people in the city of Detroit have actually received less than half the number of first doses than people living in the remainder of Wayne County. That is completely opposite of the number of vaccines distributed. So really, depending on how you look at the data, there are frankly different conclusions to be drawn.
All right, thank you, Doc. And our Tracking the Vaccine event, it is just getting started. Here is a look at what's coming up on Local 4 over the next few hours.
I'm Defender Sean Lay. Local 4 is tracking the vaccines all day today. We have team coverage, frustration, more demand than supply. I investigate where are the shots and why Wayne County seniors are especially distraught over this rollout.
I'm Sandra Ali, reassuring those who are fearful of the vaccine, who's speaking out against misinformation, and showing others the shot is safe.
I'm Hank Winchester. So what can you do to get the COVID-19 vaccine or get the vaccine for an older loved one in your life? In my Help Me Hank report, we're collecting the best insider information from those who've had success getting an appointment. That's tonight at 11.
Now, in other news, there is new help with this icy disaster. It's been playing out in several neighborhoods all along the St. Clair River. Now, the trouble started 2 days ago as ice jams pushed the water onto streets and into homes. Now, the U.S. Army Corps of Engineers is giving technical advice to the Coast Guard's ice-breaking operations. They're helping to guide 4 Coast Guard cutters, hoping to bring relief to the area. Good news on the repairs that have been going on all day at southbound I-75 at 7 Mile. Hope you didn't get caught up in that. We just got word all the southbound lanes have reopened. MDOT was working on the overpass after it was hit by a truck Wednesday afternoon. Those repairs are now complete. Again, all southbound I-75 lanes are open at 7 Mile, just in time for your drive home. From Washington, House Democrats are asking former President Donald Trump to testify under oath as part of his impeachment trial. They say he must explain why he and his attorneys have disputed key allegations in the case against him. He's being asked to testify as early as Monday and no later than a week from today. Right now, we're waiting for a response from the former president. Still ahead first at 4. This country music star facing a massive backlash after being caught using a racial slur. The impact and his apology. Up first, an apology on the floor of Congress. This Georgia Republican faces unprecedented punishment for her racist rhetoric. We'll tell you where things stand at this hour.